a lot of the recognition of venous disease has to do with proper identification and diagnosis of the condition. The burden is actually quite substantial. 25% of people under the age of 35 have some degree of venous insufficiency, and 50% of people over the age of 50 have some degree of venous insufficiency. This represents a spectrum of disease varying from asymptomatic patients to chronic non-healing venous ulcers, and therefore represents a spectrum of presentation that translates into complex management decisions. The impact of this type of disease and the incidence is also pretty substantial. The reality is that oftentimes patients encounter venous disease symptoms that aren't necessarily diagnosed correctly or managed correctly in the clinical setting. And as a result of that, the natural progression of the disease, that from venous hypertension to valvular insufficiency to varicose vein formation and ultimately venous ulceration, continues unchecked and untreated.